Well, here we are in September already. Welcome, everyone, to our conversations on brain health. This month, we're actually looking at cognition and mental health, and we have two experts directly from our Rush team, two neuropsychologists who are joining us for this conversations this evening. Um, as in the past, real quick housekeeping items. I want to make sure this is interactive. So any questions that you have, please feel free to enter those into the chat box, and we will be sure to monitor that and answer as many of those questions within the 1 hour time frame that we have allotted for this webinar. I'm thrilled that we have transitioned to Zoom. Hopefully everybody has been able to join smoothly without any difficulties, and apologize that has been a problem in the past. A little bit about our two speakers for tonight. So Dr. Monica Diorio, she has been, some of you might have seen her in our master classes. She has been very involved with our brain health educational program. So it's always nice to be able to invite her back. For those of you who do not know Dr. Diorio, she is an assistant professor in the neuropsychology service within the Department of Psychiatry and Behavioral Sciences at Rush University Medical Center. She received her doctoral degree from Wayne State University with a specialized training in neuropsychology. She then completed her internship at the Clement J. Zablocki VA Medical Center and her postdoctoral fellowship in adult neuropsychology at Rush. Her clinical and research interests include cognitive and emotional rehabilitation and psychoeducation as an intervention. She provides outpatient neuropsychological evaluation and cognitive rehabilitation treatments at Rush. And she is also involved in training current interns and postdoctoral fellows. Our other speaker for this evening, I'm thrilled to have Dr. David Gonzalez join us as well. He is a board-certified clinical neuropsychologist who completed his specialty internship and fellowship at the Audie L. Murphy VA and received his PhD in clinical psychology from the University of Northern Texas. He specializes in how neurological disorders can impact cognition and mental health, and previously worked at the University of Texas Health Science Center in San Antonio before starting in the Division of Movement Disorders at Rush University Medical Center in 2022. So glad to have both of you with us for this evening. I know this is going to be a great discussion and always a topic of great interest to our audience. So at this point, Dr. Miravalle, I'm going to turn this on over to you to get us started.
Kathy, and thank you again, Dr. Diorio and Gonzalez, for joining us. It's a pleasure being here. This is our conversations on brain health for the month of September. And we decided to start with this topic because we continue to get questions from our audience and participants on trying to understand how MS could affect cognitive function. And I think that the reason is because sometimes patients have a hard time understanding how much of their symptoms are due to fatigue, how much of their symptoms are due to perhaps underlying depression, or maybe you have a bad day and you can't remember where you put your keys, or maybe you're at work and you're stressed and somebody's telling you something and you just can't remember what they said, the conversation. But then if you wait a few more minutes, that information comes back to you. So how can we know if those lapses in memory, those lapses in cognitive function are due to multiple sclerosis, perhaps due to stress, perhaps due to underlying conditions like depression? So we thought to kind of invite these two guest speakers, which are experts in trying to disentangle those cognitive symptoms and try to help us kind of understand, when do I need to worry about my cognitive function? When do I need to talk to my neurologist? When would be appropriate to perhaps do a more in-depth neuropsychological testing. And we will hope to finish with conversations about, okay, let's say that someone has some dysfunction in cognition. What can we do to help to remediate those symptoms? And as usual, we encourage your participation. You should be able to have in the chat box an opportunity to type your questions. As Kathy mentioned, we just changed to Zoom, and we are very excited because we hope that this is going to make everything a little bit easier for all of us. So without further ado, why don't we start? Maybe I can ask Monica. In your experience, Monica, when you work with MS patients, what are the typical cognitive symptoms that they share with you?
Yeah, I think the first thing that comes to mind when we talk about cognitive difficulties in MS is processing speed difficulties or speed of thinking. So oftentimes we talk about that as like a hallmark symptom cognitively. Combined with that is memory problems tend to be pretty common, specifically difficulty getting the information in. And it's possible that's actually related to some of the processing speed difficulty. So if you think about someone giving you information in a conversation or at a doctor's appointment, and if they're speaking quickly or giving a lot of information at once, if someone has processing speed difficulties, it might be harder to grab on to all of the relevant information. And what we've seen in research is actually if we take someone with MS who might have more difficulty with memory overall, but we give them more opportunities to learn the information and review it multiple times. Once that information is in general, it stays in pretty well and they can hold on to it. But that initial learning or taking in the information can be affected. So those two stand out. There are certainly others. Sometimes there's difficulty with word finding, that experience of feeling like you know what you want to say, but you can't quite grab onto the word. And then maybe it comes to you after a little bit of time. Sometimes visual spatial difficulties come into play. But it's also important to remember that all of this is coming from research with many, many, many people and looking at averages. So in the individual person, there's a lot of variability in what difficulties in thinking might show up. But those two, speed of thinking and memory, especially getting in, are the ones that kind of raise to the forefront, I would say.
Excellent. And yes, I often try to explain how the brain works by making comparisons, and I like analogies. And I often say, well, the brain, imagine that it's like a computer, and the speed of the processor is going to determine many functions, but how efficient that program is going to run. And one of the things that MS can do, not in everyone, but in some people, may affect that speed of processing. And that can result in terms of cognitive function, can result perhaps in difficulties dealing with too many sources of information simultaneously. And that's why sometimes multitasking can play against what we want to do. And with multitasking, sometimes means, well, if you're working on something that you want to get accomplished, maybe stop noise or background or conversations that may distract you from that common goal. But I want to dive a little bit deeper into first understanding if someone has a cognitive symptom and whether that is due to MS. So, Dr. Gonzalez, I'm going to ask you now, you have such a broad experience with neurological disorders, even outside of MS. I mean, you specialize in Parkinson's disease, in movement disorders, in dementias like Lewy body dementia. And we know that many of those conditions can also affect cognitive function. But we also know that aging, which is happening to all of us, can affect cognitive function. So, how can you help someone that is perhaps listening to this podcast, whether it's MS patients or family members, understand when would a cognitive symptom should raise concern on being due to, let's say, an underlying disease versus just simply aging?
Well, I mean, I've been aging since the day I was born. So, it happens to all of us. And that honestly, that's a bit of a tricky question to answer. And there are a few routes that we can take. I mean, one is more first, someone noticing that I would call your kind of like individualized experience. So each individual living with MS may have a sense of kind of who they are and who they are in the world around them and how they typically react to it. And they typically have family members as well too, who have a sense of kind of who they are and how they interact with the world. So I'll kind of divide this into like the individualized perspective, and I'll jump into like an objective approach as well too that we can take, which is where we come in as professionals. But with the individualized approach, I mean, one thing to do is to first knowing who you are and how you typically act. If you start to feel that there are difficulties, first off, trying to notice if there are any sorts of trends. Like, does it happen just with the night of poor sleep, but then other nights it's fine? Sometimes we might have little lapses, but because we have a diagnosis, we tend to be almost maybe hypervigilant isn't the word, but we're really looking out for things because we're kind of trained to like, you have MS. And so there may be symptoms that kind of crop up. So you need to be looking out for them. So sometimes there may be like, oh, there's something that is this kind of a true change, or is this just kind of a normal up and down that we all have as humans that I'm paying more attention to? So notice if it starts happening in more than one situation over the course of several days, if it's linked to anything, and check in with family to say, have you noticed anything at all with, whether it is that like, maybe I've had to jot down a few more notes when we go to the grocery store, or, you told me that we had a dinner upcoming next week, and I kind of lost track of it until you told me the night before. So that's kind of the individualized approach, where it's just kind of, yourself, your family knows you, and you kind of get a sense, is there something that's consistent? Is it linked to things? And if you're starting to notice that, and especially if it's starting to impact whether relationships, whether, your healthcare and kind of missing medications or showing up for appointments, certainly then you would want to then raise it with a professional. And then there can be an objective approach, which is where you essentially come into a clinic and you do these kind of, I like to call them brain exercises, but getting at different areas of thinking, like, hey, I'd like you to remember a short story, for example, and how much you're able to learn initially, how much can you remember after a period. And we have certain ways of then seeing what's within expectations for age. Because as you adeptly noted, Dr. Miravaya, there are certain changes that are just a natural part of the aging process too. So we see, is there anything outside of age expectations? And then additionally, if you have something that's called the baseline evaluation, or if you've had kind of a screening evaluation that a lot of neurologists will do, we can actually look at you as an individual instead of assuming what we might expect for individuals of a similar age and background. We can look at you as an individual and see, has there been change that's beyond what we see from the aging process? So it's kind of, even within your individualized and objective approaches, there are a few different tacks that we can take.
Excellent. So it's nice to know that there are ways in which experts like yourself can help determine whether those symptoms and perhaps that cognitive dysfunction is due to aging or more specific to the disease. On the good news side of things, and I always like to remind us that there's always something we can do for most problems in medicine, at least in multiple sclerosis, is the lifestyle interventions that we are so passionately advocating here that helped with multiple sclerosis brain health also seem to be very similar to the lifestyle interventions that help to prevent accelerated cognitive decline in aging. So in a sense, it seems like if someone with multiple sclerosis is already doing the things that we always talk about, like eating healthy and having proper sleep and being mindful of perhaps comorbidities like obesity or hypertension, it seems like those interventions are all also going to benefit not only a slower decline in cognitive dysfunction in MS, but also help with a healthier aging process. So, Dr. Diorio, I'm going to now shift gears a little bit about the clinical manifestations of those cognitive symptoms. And in MS, we often talk about, symptoms appearing as relapses, which is this, sudden onset of symptoms that perhaps come with dysfunction or loss of function that lasts at least 24 hours and slowly improve over time, sometimes with complete, sometimes with incomplete recovery. However, rarely we see that cognitive symptoms follow the typical relapse pattern. It's usually mostly this slow, progressive accumulation of problems. So how would you help us kind of like understand what will be a typical kind of pattern of symptom in cognitive dysfunction in multiple sclerosis present?
Yeah, you're right. The thing that we think of most of the time is this very slow progress over time that seems to be linked to a lot of the lifestyle factors that we talk about and kind of overall brain health and physical health factors that slowly over time we can see this, we call it kind of an insidious process where it's kind of slowly sneaking in and you might be noticing it more and more. I will say, actually, relatively recently, there's been some acknowledgement of potentially there being some cognitive relapses. It's a little bit of a work in progress, I think, to understand what's happening there. But there seems to be a possibility that there might be cognitive relapses where there's this temporary kind of flare up of cognitive difficulty that then improves, but maybe not quite back to baseline. And so then you might see if that happens several times, that could also contribute to some of that slow change across time. But again, this is not set in stone, and there's many behavioral, lifestyle, health factors that you can do to help keep your brain as healthy as possible for as long as possible. And we can see things stay pretty stable for a fair amount of time. So it's important to keep that in mind and work on those things that are in your control to stay healthy and be able to do the things that you enjoy, live that life worth living.
Absolutely, and it's. I'm glad you mentioned about the cognitive relapses, and particularly now with the use of highly effective therapies, something that we are noticing is that because these medications are so effective in preventing acute inflammation, often we see that patients don't have as many relapses as the traditional definition of a relapse. However, they might be those transient episodes, dysfunction occurs. And those are kind of like mini relapses in a sense that we are seeing that perhaps speaks to an underlying ongoing activity with inflammation that is partially being controlled by highly effective therapies, that now we are able to kind of recognize that as before, when patients have, let's say, a relapse with an optic neuritis, of course, they're going to be more tired, they're going to have a headache, they're going to have cognitive dysfunction, but perhaps in the past we didn't pay attention as much to those symptoms because we were focusing mostly in the optic neuritis. But now we are starting to slowly recognize that there are those mini events that occur even in the context of highly effective therapies. Kathy, are there any questions from the audience?
Yeah, and there's actually a really great question. And this could go to any of you three, actually. It's whether there is any statistical data showing an increase in getting dementia or Alzheimer's if you have MS. And if there is, does it onset earlier in age than the average individual? Great question.
I can start the answer and then pass it along to my colleagues here. So there are conflicting evidence data on Alzheimer's and MS. I will say the earlier studies suggest actually an inverse correlation between MS and having dementia, at least Alzheimer's type dementia. And with that, I mean that having multiple sclerosis decreased the overall likelihood of someone developing Alzheimer's. And that's without counting the genetic family related Alzheimer's dementia will be the late onset Alzheimer's. Most recently, there might be, there was one study that suggested that might not be the case. And again, I probably partially is due to the fact that perhaps with the medications that we have, we are taking care of the inflammatory portion of multiple sclerosis. That was the explanation by which Alzheimer's pathology did not occur. The earlier observations suggested that inflammation in the brain that is driven by multiple sclerosis perhaps may have prevented the deposition of amyloid plaques. But now that we are so efficiently taking care of that inflammation, perhaps we are seeing that that those numbers may shift over time. Dr. Diorio Gonzalez, anything else to add?
Real quick, Dr. Miravalle, you kind of broke out for a split second when you were talking about those amyloid plaques. Can you repeat that real quick? Sorry. So everybody
Yes, so
could hear you.
I was mentioning that in the past, the observations that having MS decreased the likelihood of Alzheimer's perhaps was explained by the fact that inflammation in the brain that is triggered by MS could have prevented the deposition of amyloid plaques. And that was the way that we explained that observation in the past. But now that we are so efficiently preventing inflammation in MS, perhaps we don't see that correlation. Going back to what we were talking before, interestingly, the lifestyle interventions that are so effective in helping with MS over time also are similar factors that have been shown to impact on the likelihood or risk of someone developing Alzheimer's dementia.
Mhm.
Yes, and that's
Excellent.
actually what I was going to mirror that response as well, and thinking about, there's many things that increase risk for dementia of any kind, including Alzheimer's disease. There are other types of dementia as well, and really the things we recommend when thinking about, well, how can we mitigate that risk, are things like diet and exercise and staying cognitively active and engaged in your life. And those are the things, if you put your focus and energy there, that are going to help reduce that risk.
As a matter of fact, I always refer back to the Lancet article published in 2022. Was this large group of neuropsychologists and neurologists that came together to finalize the evidence behind lifestyle interventions in someone's life journey and assessing their contributions to the risk of dementia. And from that paper, there were these 12 modifiable risk factors that altogether could add to a 40 to 45% risk of dementia. So if you think about, reducing that risk by 45% is the most effective therapy that we have. And among those factors, you have things like, early childhood education or attainment of education in life. Things like smoking, of course, will increase the risk of dementia. Diet, hypertension, hearing loss, social isolation. So those are the things that we know that will have a positive or negative effect on the overall risk of dementia. Dr. Gonzalez, when you see patients actually in your clinic, do you find that sometimes patients have more than one reason to have cognitive decline?
I do, yes. And I was actually going to, I'll just ask have you all talked about in the past, like what dementia is too? Because sometimes, in the prior brain health meetings that you all have had, or no?
Perfect time
No.
to do that.
Yeah, you go right ahead.
Okay, then I can dive in. Yeah, I mean, the way that I conceptualize it, because dementia is an umbrella term. Because a lot of times people think about it as synonymous with Alzheimer's. But Alzheimer's is just kind of one cause of dementia. So dementia's umbrella term, sometimes it's also called major neurocognitive disorder, as another term that you also sometimes see in the literature if you're reading up on this. But essentially there are kind of three parts to it, which is that with a dementia or a major cognitive disorder, there are changes to the brain that then ultimately end up impacting thinking abilities to then such a degree that the person has difficulties doing kind of cherished or important daily activities independently. So that's what it is. Brain, thinking, your life. And there can be a lot of pathways there. So a lot of times when people think about dementia, they think about what we typically would call like a degenerative condition, like Alzheimer's or what Bruce Willis had, or frontal temporal or primary progressive aphasia. But there can be other conditions and causes, and a lot of times they co-occur because that's the reality of life, is that we live lives that can sometimes push up against our brain health. So in addition to, I work in a Parkinson's and movement center, but a lot of times we'll see individuals that may have had untreated diabetes and cholesterol and blood pressure for years. And over time, that impacts the energy that's being sent to the brain. So there's like what's called a vascular or metabolic contribution. Sometimes an individual may have had several, a multitude of maybe severe concussions or even a traumatic brain injury, which would be kind of a moderate to severe traumatic brain injury in their past. Maybe that could have even been related to their symptoms, to where they had a motor change because of MS, and then that resulted in an accident where they hurt their head. And so the short answer is that yes, there can be kind of multiple causes, unfortunately.
Well, thank you for that, and also for defining dementia. And this is a perfect moment to talk about mood, because often we find that it's relatively simple for us providers to throw definitions out there and says, mood disorders is that, and depression is defined as this, but then when someone is living with those symptoms, it's extremely hard to know, okay, I feel that everything shuts down. I feel that I can't concentrate. I can't focus. I have no energy to move around, and I have no motivation. I just want to stay home. What is that? Is that depression? Is that fatigue? Is that lack of energy to do cognitive or engage in cognitive activities, cognitive dysfunction? So how can someone, Dr. Diorio, try to, in a practical way, understand how are these symptoms, in a sense, affecting cognition, and how can we help individuals navigate that?
Yeah, it's a really good question. And it's complicated, like everything else that we've been talking about. I think that all of these things, when we think about mood and mood disorders, including something like depression or anxiety, fatigue, sleep difficulty, cognitive difficulty, all of those things are interrelated. And they can kind of go in both directions. So we might think about someone who has depression, who feels low, sad, or down most of the day, most days out of the week for at least a couple weeks. One of the symptoms of depression is difficulty concentrating. And you might think about the lower level of energy that comes with depression. Sleep difficulties come with depression. Sleep difficulties can then also lead to fluctuations in mood and thinking ability. So this can kind of cascade. And it also can go in the other direction. So if somebody starts with cognitive difficulty or a new diagnosis or a chronic condition of MS and the lifestyle changes that might come with that, those things that you might be struggling with, symptoms outside of depression or anxiety, might lead to depression and anxiety symptoms and those being more likely. So it goes in both directions, which can make it difficult to tease apart, especially when you're living it. I would say there's a couple things to think about. One thing, I always encourage people to talk to your providers about it and explain what you're experiencing. They're going to ask you questions about timeline of symptoms, when things showed up, and certain constellations of things that tend to kind of hang together to try to clarify that. Sometimes we can't clarify it, and we might say, okay, I don't know. It seems like you are having some difficulties maybe with attention. You have MS and fatigue is at play here, and it looks like you might be experiencing depression. Let's work on what's in our control. So let's treat depression maybe first, or sleep difficulties, and try to get some of those factors under control as best we can. And see what happens, see what gets better and what's still there, and what might be helpful next after that. And that can be a good step to take. And there are a lot of good therapies, whether that be psychotherapies. There's a lot of evidence for a type of therapy called cognitive behavioral therapy, especially for depression and anxiety as well, including specifically in people with MS. That involves learning more about how you think about things that you experience in the world. So that's the cognitive piece. And then your behavior, what you're doing, cognitive behavioral therapy. What actions are you taking? How are you moving forward on things that are important to you in your life? And how can we work in both of those areas to learn new ways to cope? There's also a lot of discussion around learning what's called more active coping strategies, of taking a look at what you're struggling with and how can you address that, either by making some changes maybe in your life or situation, or changing how you're thinking or acting, versus more passive coping strategies, which are things like avoidance, right? Like push that away, I can't deal with that.
I think we lost Dr. Diorio, but that was a phenomenal comment. I want to add to that the fact that sometimes as providers we advise our patients to sorry Monica, I think we lost you temporarily. Did you want to finish your
I'm not
comment?
sure where I cut off. I stopped talking and everyone was frozen.
No, you were mentioning about cognitive behavioral therapies and coping mechanisms.
Okay, yes. So I was just mentioning you can learn some different styles of coping, specifically more active coping strategies where you can address specific problems that show up, how you think about them, how you respond to them, in contrast to more passive coping strategies, which tend to be things like avoidance, right? Like this is too stressful, I can't deal with this, I'm gonna push it aside or push it down, which can work short term, but tends to cause more problems over time. And
Well,
then I said I was going to pause because I have a tendency to go down several rabbit holes with this topic.
No, that's exactly what we want. This is the exact intent for these conversations, right? And ultimately to help our patients navigate these difficult situations. Sometimes I remind our patients that we're a team and they don't have to figure it out alone. But this is a process that we all work together to try to figure out what is happening. But there are things that our patients have control on, and a couple of things that they can do to help is, number one is observe. Try to pay attention to, as Dr. Gonzalez mentioned, triggers or patterns. Are these symptoms happening in certain circumstances? Is this happening in the context of a very stressful situation? The second one is control stress. And that's something that only patients can do themselves, right? Whether it's external factors of stress or internal factors of stress, stress is that one common theme that is going to make everything feel worse. And sometimes it's kind of like the trigger, sometimes it's a consequence. But anything that our patients can do to maybe pause and take a break and go for a walk or remove yourself from a stressful situation, practice some mindfulness, meditation, or take a nap. There are certain things actually you can do to help that regardless of the cause of the cognitive symptoms, stress reduction is only going to help. Kathy, I'm going to bring it back to you. Any other questions or comments from the audience?
Yes, there were two questions. And this one is perhaps leading more into individuals that might have had a stroke or, some kind of brain injury that ultimately wondering if there's anything that can be done beyond perhaps having just a baseline cognitive testing done to that ultimately can be of better service for them and assist them in that process to kind of evaluate where they are and what potentially they need to be looking out for.
Question. I can probably start the answer and then pass it on to Dr. Gonzalez. But usually we recommend that if there are no cognitive complaints or symptoms, we don't refer patients for a formal neuropsychological testing. We often do is what is called a screening test in the clinic. In MS, we used a test called Symbol Digit Modality Test or SDMT. That's a test that actually measures processing speed. Sometimes we use another test called MoCA or Montreal Cognitive Assessment Tool. So we do that in the neurology clinic. And if we do see a pattern that is within the normal range, we just leave it alone, perhaps check again in a year. If we see there are any concerning numbers, that's when we start digging a little bit deeper into, okay, what is happening here? And often that triggers another screening tool for depression, for anxiety. We do a screening tool for fatigue to try to understand, are there other factors that play a role? In the case of stroke, we know that stroke, like any vascular disorder, can affect the health of the brain. As a matter of fact, one type of dementia is being linked to vascular disorders. So, Dr. Gonzalez, what can you tell us when patients actually reach to you and someone recommend to do a neuropsych testing? What are the typical patterns that you see in patients with vascular pathology?
Yeah, I mean, well, there are a few things there too, because then we can also touch on the question was kind of like how to respond, like what to do after a stroke as well too. But the types of things that we see, it's actually, there's a lot of overlap with MS in as much as there are general rules of thumb that we see that most individuals might notice maybe a little bit of a lag in responding, or kind of that processing is maybe inhibited to a degree. With memory, it might take a little bit more time to learn, or you might need more reminders. Might be harder to multitask or kind of juggle a lot of things at one time. But it also depends on where it happens. Similarly, like if you have an MS relapse, depending on kind of where it is, how there can be different sensory or motor signs or symptoms, you can also have particular differences in cognitive signs. And the same thing applies to like which particular artery in the brain. Was it on the left side, closer to the memory area? Was it something that was on the right side, closer to kind of the visual spatial perception area? But regardless, if you've had a stroke or injury like that, you typically would want to talk to your doctors about bringing on some sort of cognitive rehabilitation. And I won't talk too much about that because I figure we might talk about that later, but there are particular rehabilitative professionals that work in stroke centers of inpatient, outpatient rehabilitation.
So no, I think it's a perfect time to maybe shift gears a little bit and talk about cognitive rehabilitation. We always want to, provide our audience with some data, some facts, but also hopefully solutions, right? So how do we move from here? And one of the things that we talked so far is maybe talk to your healthcare team, making a an assessment, whether it's through screening tools that we can help you kind of discern what is happening here, maybe do a formal neuropsych testing. But once we go through that path of assessment, what's next? How can we help patients actually improve in these areas of concern, Dr. Diorio?
Yeah, there's a number of different ways that someone can improve, whether that be, so oftentimes after someone goes through a neuropsychological evaluation and gets a better understanding of what difficulties might be showing up and what might be contributing to those things, we make some recommendations around changes that can be made in day-to-day life. And those can fall into usually two categories, I would say. Some of the lifestyle factors that we've talked about, oftentimes we discuss changes in diet and regularly exercising. There's a particular type of diet called the MIND diet that we recommend frequently, but it's not a one-size-fits-all, but oftentimes lots of more leafy greens and nuts and berries, lower in things like cheeses and fried foods and things like that. And I always tell everyone something's better than nothing. That goes for dietary changes and exercise as well. So start where you're at and build from that. So that's one area of recommendation that we talk about. The other is learning some strategies to support thinking, primarily attention and those first stages of memory, of taking in information early on. So either through compensatory strategies, this can look like things like a calendar and using a calendar in the way that's most effective for you. So that involves things like getting a routine where you're using it every day, pulling it out, looking at what's happening today, what's happening this week. Only having one calendar or one main calendar. So if you have too many, that raises the possibility of things falling through the cracks if you check your refrigerator calendar, but not your phone calendar, right? So note-taking strategies, things like that, backup systems, that's one area that you can either learn on your own or work with a professional to learn what would be most helpful and get that routine in place. We also have strategies like visualization strategies or making associations. So there's a group out of Kessler Foundation out in New Jersey, and they've done some nice work in the cog rehab space for people with MS. And a couple of interventions they use. One is a story memory technique where when you're trying to remember information, you have to pick up a few things at the grocery store, for example, turning those things, that list of items from the store, into pictures that you can visualize and maybe put into a story together. So now you have visualized pictures and context meaning to the pictures. And what this does is it helps your learning. It helps make more connections in the brain, so you're learning the information at a deeper level and you're being more intentional about how you're learning and taking in the information. So when you go to the store later, it's easier to pull that information up. So that type of visualization strategy can be helpful, along with other ways to learn information, practice rehearsing across time, learning things in different modalities. So if you see something, you write it down, you read it, and you explain it to someone. Now you've had repetition and in different ways. Those types of things can be helpful. And then the one other area I would say is addressing mood, and the overlap of mood and sleep can be integrated into that work sometimes. So Dr. Miravalle mentioned mindfulness earlier. If y'all have been in the master class with me, you've probably heard me talk about mindfulness. I'm a big proponent, but the idea is paying attention to the current moment in a non-judgmental way. So we spend so much time in the future, what's coming up, what's going to happen, what do I need to do, or in the past, why did I do that? Why did they do that? What happened? Replaying things in our brain. And relatively little time really fully present and in the moment. And that can get to be a distraction. So practicing pulling our attention into the moment, what's happening right now, and noticing what your mind is doing, and refocusing can be helpful. So that's just a smattering of things that can be done. Sometimes there's computerized cognitive remediation that's done. Usually that's done after an acute event, and tends to be a little bit less support for that in some scenarios, but it's also not something I provide, so I have a little bit less familiarity with that piece. So some neuropsychologists can provide this service, a cog rehab service. Sometimes speech therapists will provide it, or some other professionals, especially on an inpatient setting. Oftentimes it's speech therapists who teach these strategies, even if they're not specifically addressing speech. They might be working on attention and memory.
Excellent. Great answer, Dr. Diorio. And I know you offer through Rush what is called the Neuro Resilience Program. Can you speak a little bit about that? How long it is and how patients can access that program?
Yeah, absolutely. So we call it our cognitive resilience program, and it's brief, it's short term follow-up care for our neuropsychological assessment. So if someone comes to our service and does a comprehensive neuropsychological assessment, we do some measurement of thinking abilities. We would talk with them afterwards about if some work in cog rehab could be helpful, and if they're interested in that, we set up that work. It's typically we start with 5 to 6 sessions, so pretty brief. It is solution focused, really thinking about what are the areas of life that you're noticing difficulty. What have you tried already, and what can we give you to help support you in those areas, and set up some strategies and routines, get those in place so that you can then continue building on that and integrating those strategies in your life after the treatment is over. So sometimes we add on after 5 to 6 sessions. If you're benefiting and still have questions, we can certainly add to that. But usually we wouldn't go beyond maybe 15 sessions would be kind of the long end.
Excellent. Thank you. Thank you for doing that. It's so helpful. And you mentioned technology, and I just can't help but to reflect on, now we are bombarded with these AI programs that helped us kind of navigate cognitive function, right? I mean, I write emails, and if I have to write a long email, I just first write it on ChatGPT and see whether I got it right or wrong, which is wonderful to improve our efficiency. But at the same time, I keep thinking, am I becoming dumber because now I rely so much on AI that I'm not even thinking on my own? So, Dr. Gonzalez, what is your take on how can we use AI and technology to help us enhance function without losing the ability of us challenging the brain in a way that will help the brain continue to be cognitively intact?
Yeah, that is a difficult needle to thread, and one in which, is also like trying to thread a needle on a moving train, right? There's just so much change going on here. It's the way I like framing this is you maybe need to take a step back and think about what is it that you care about as a person, whether it's your own personal values, particular activities, or people in your life. And if there's a tool that helps you connect with that, go for it. Use it. And AI can do that. AI, if you're noticing that it's taking longer to put together an email. I mean, first off, our society and environment has changed, and that we're just so bombarded. And if you add on top of that, then a neurologic illness like MS, and so you notice you're already bombarded, everyone's bombarded, and you're noticing it's taking longer. And there's other things that you need to do because of this ongoing bombardment. Use the tool that helps you send that email out. That's not so much, it's a part of something in your life, but it's not the important thing. So use these tools. Of course, always, I mean, I mentioned the moving train because the accuracy can be suspect. So you always want to double check and make sure that you're not giving yourself over completely to the tool, but that it is a tool. But you want to make sure that the tool's working. You want to maintain your tool, that it's actually cutting the way that you want it to carry that tool analogy. And that needs to be balanced with maintaining an active mind. The same way we've talked about physical activity and cognitive rehabilitation, whether it is a computerized program that you're doing, but even it could be, have a book club or movie club discussion or game night with family. It could be have maybe there's some sort of current event and actually having kind of a conversation about kind of pros and cons, things that you liked or didn't like about it, how it interfaces with your life. So you still, I mean, depending on what your life looks like, want to incorporate challenge and stimulation because that's one of the brain health pillars, and do that while using tools in these other aspects of your life. So I think they can both be done, but we do need to be mindful about how we're doing them and what facets of our life we're using them in.
Excellent. Great answer. And I have to agree with you. I try to use them as a tool, but I think continue to learn is something that we know that our brain gets better the more we use it. And so anything we can do to learn something new and also diversify our functions in life, right? I mean, so all you do is physical activity. Yes, you get great at that, but also you need to supplement that with more artistic and cognitive challenging tasks as well. So create your menu, whatever works for you and you enjoy, and try to diversify that menu as much as you can. Kathy, any additional questions from the audience?
I think we hit most of them. I mean, we talked about managing stress. Dr. Diorio just spoke about mindfulness, and I love her comment about being present in the moment. I think that is so important because we do tend to get caught up of worrying about things that have occurred and things that are going to occur in the future. So managed to discuss that. There were questions about cognitive rehabilitation, which I think we covered very nicely as well. I think we're pretty good.
Very good. Well, one last comment, Dr. Gonzalez. Anything you want to share with the audience to wrap this wonderful session on cognition and multiple sclerosis?
Yeah, well, it was a comment, but also a question to you as well. Does the National MS Society still have MS navigators?
Yes, they do.
Yeah, excellent. Because that's what I was saying. We've talked about this kind of, broadly speaking, but if you actually want to find someone to work with, whether it's a counselor or a therapist to focus on emotional health and stress management, whether it is a speech language pathologist or neuropsychologist or rehabilitation psychologist to focus on the cognitive piece of things, I found when I would work with them previously, the MS Navigator is exceptionally helpful for connecting folks locally.
I think that's
Very
fantastic that you just mentioned that, Dr. Gonzalez. Thank you for bringing that up.
Dr. Diorio, any final comments or advice to our wonderful audience?
I think I also wanted to add with the MS Society, they also have some nice websites, pages on cognition and discuss some of the strategies we talked about today. So if you're wanting to review, well, great, there's some things that can be helpful, but what exactly are those things again? And have some of that repetition and building on your knowledge, that could be a good resource for you. I also think we've been talking all throughout today about the different lifestyle changes that can be helpful for brain health. And I just want to emphasize, I think maybe our culture or in the world, we hear a lot about how behavioral things that we do, diet, lifestyle, can have negative impacts on our brain. And so just a reminder that those same lifestyle factors done differently can have a really powerful positive effect on our brain. And so just like the brain affects what we do affects our brain. And so just kind of giving a reminder for that.
Absolutely. And my last advice to our audience is be kind to yourself, be kind to your body. And that's why we emphasize, rest and exercise and eat healthy, but also be kind to your mind. And most of the stressors that we have in life are self-induced, whether it's directly or indirectly by the things we choose to do or the people we choose to surround ourselves with. So maybe take a break and assess, what are those sources of stress, and if that's you, well, then stop doing it to yourself and be kind to yourself and practice, gratitude and learn how to give yourself credits for all the wonderful things you do. And if it is something external, maybe consider removing yourself from that environment. And with that, I'm going to pass it on to Kathy. Kathy, can you remind us what is coming in the next conversations on brain health in the future?
Yes, absolutely. I love, real quick, I'm going to just jump back to the comment Dr. Miravalle just said about gratitude, because that will be our November conversations on brain health. And in preparation of Thanksgiving and everything, we will be talking about the practice of gratitude, as well as having some practical healthy meal options for our holiday season. But that's November. Jumping to October, we will be discussing updates that are coming from the ECTRIMS conference. So ECTRIMS is the largest multiple sclerosis conference that is being held over in Europe. And we will have Dr. Miravalle as well as Dr. Shoemaker providing us updates from that conference. There's always a lot of good data that comes out of it. So that date for our next conversations on brain health will be October 13th. As usual, it's always our second Monday of every month. So October 13th is our next gathering, and we hope to have everybody back for that event. Anything else from your side, Dr. Miravalle?
Oh, I think that that conference, it's going to lead a lot of new data on medications and research. So if you're interested in research updates of what is coming in the pipeline in terms of medications, tune in to another session. And of course, all of these sessions are recorded. So even if you miss that, you can always go back and listen again. You can check our previous sessions as well. And with that, I would like to thank Dr. Diorio and Gonzalez for your wonderful participation. And Kathy, I bring it back to you.
Yes, and I would like to mirror Dr. Miravalle's comment as a huge thank you for having both of you as our guest speakers this evening. Really wonderful information that you provided to the audience, and I know it's always greatly appreciated. So thank you so much for being with us this evening. And as Dr. Miravalle says, yes, all of these sessions are being recorded. So if there's any particular areas where you still had questions, you can always go back and rewatch the recording, which is on the RESH YouTube patient education channel. So if anybody does need that and is confused in where to find that, feel free to reach out to me directly. I'm always glad to pass that on. Hope everybody has a wonderful evening, and thanks for joining us. Take care, everyone.
Thank you so much.